All right, good morning again, Brian.
Good morning, doctor.
You've been here now 3 days, and I think you've gotten significantly better, at least from our perspective. You look better, and your labs are better. Do you feel better?
Yes. Yeah, I do feel better.
Okay, good. Well, the good news is I think you're ready to go home.
Oh, good.
Good. So there are a couple things that we have to do before you can go home, though, okay? Because I don't want to send you home before you're ready, because that would just mean that you'd probably have to end up back here, okay? So I want to go over a couple of things that we're going to be working on today before you leave, and then I'm going to go over what's going to happen after you go home, okay? So before you leave, we're going to have you today give yourself those shots that you've been getting from the nurses, okay? So you know that they've been giving you insulin 4 times a day, right?
Right.
Right. So what you don't know is maybe what kind of insulin they've been giving you. So during the day, they've been giving you mealtime or short-acting insulin. Those are insulins that prevent those really big spikes in blood sugar after you eat a meal, okay? You get those before breakfast, lunch, and dinner. And that's what you've been getting over the last 24 to 48 hours, right?
Right.
Okay, perfect. And then you've been getting that long-acting insulin, or the Lantus, at night before you go to bed. You've probably been realizing, it's kind of weird they give me one before bed, but then they don't feed me anything, right? Okay. And the reason for that is those short-acting insulins, like I said, are supposed to prevent the spikes in your blood sugar after you eat a meal. But the one that you get at night is actually a long-acting insulin. It just secretes a little bit of insulin all day long for 24 hours. So we don't have to worry about when that's given in terms of having you eat a meal, okay? So today you're going to be giving yourself your breakfast shot and your lunch shot, just to make sure that you're comfortable actually giving yourself the shot and poking yourself, okay?
Okay.
They're going to show you how to draw up the insulin, how to attach the needle, and then how to actually inject, okay? The other thing that's really important, so that's the first thing that you're going to be doing today, or your homework for today. The other thing that's really important is that they're going to be showing you how to check your blood sugars, okay? We've been doing it for you over the last day or so, but today you're going to do it yourself, okay? You're going to use the blood glucose or the blood sugar monitor, or glucometer, that's another name for it, and you're going to poke your finger before breakfast, lunch, and dinner, okay?
Okay.
And then at home, you'll mimic that, and we'll write down a full schedule of when you give your blood sugar, or when you give your insulins, and then also when you check your blood sugars, okay? And you'll go home with that information. You can just post it up on your refrigerator, and it'll be there for you, okay?
Oh, that'll help.
Yes. So I want you to go over the 2 things that we're going to be doing for you today, and that actually you're going to be doing for yourself today.
Okay. The 2 things I'll do today, I'm going to give myself a shot before breakfast and before lunch, and I will be checking my own blood sugar.
That's correct, yes.
With the machine, the glucometer.
Very good. So, and the reason that we want you to do that today is to make sure that when you go home, that you understand how to do that. Does that make sense?
Yeah.
Good, okay. And then now I want to go over a little bit about what's going to happen after you leave the hospital. Okay.
Okay.
So, in addition to checking your blood sugars, like we've talked about, and you'll go home with instructions for that, and giving yourself the insulin, I want to make sure that you understand what could happen if you end up with either too much insulin or you don't eat after you give yourself insulin.
Okay.
Okay, so I think the diabetic educator went over the fact that after you give yourself a shot of insulin, it's really, really crucial that you go ahead and eat your meal, okay? Because that insulin will drive your blood sugar down, anticipating that you're about to eat some food. Okay, if you don't eat food, it could drop your blood sugar too low, dangerously low. Okay, and some of the symptoms that you may have could be cold, clammy skin. You could feel sweaty. You could feel lightheaded. You could feel like your vision's getting dark. You might even feel like you're going to pass out, or like you're sick to your stomach. Okay.
Okay.
So those are some of the things that can happen if your blood sugar gets too low. And then I want to tell you what to do if you feel like that's happening to you. So if you feel like your blood sugar is getting too low, I want you to either drink some juice or soda or something with some sugar in it, or pop a piece of hard candy or soft candy in your mouth, something that has sugar and can bring your blood sugar back up.
Okay.
All right. And then last but not least is the follow-up. All right. We want you to come back to the family medicine clinic in about 3 months, and we're going to check on how your blood sugar's been doing over the last 3 months.
Okay.
Okay. So again, I want to make sure I've explained that okay for you, and make sure you understand everything. So tell me those 3 things to watch out for and to remember when you go home.
Okay. I need to eat pretty quickly after I after I take the shot during the day. How much time do I have, though, between the shot and...
15 to 30 minutes.
Okay.
That's a great question. Yeah.
Okay. And then if for some reason I don't, and I start feeling the symptoms, like lightheadedness or clamminess, all I need to do is get some sugar, some pop or some candy or something.
That's right. Yeah, get some sugar in your body, and you should feel better fairly quickly. If you don't, you should probably call for help, okay?
Okay.
Okay.
And then I think the other thing is 3 months. We're going to meet in 3 months.
That's right. Yeah. And we're going to check on how your blood sugars have been doing over the last 3 months, and I assume they're going to be doing much better.
Oh, good.
Okay?
Yeah.
What other questions do you have?
You know, I think this is everything.
Very good. Okay. Well, if you do have any questions, I want you to feel free to call our office at any time. We have doctors and nurses who can answer any questions that you should have. And then also remember that Diabetic Educator is there as a great resource for you too, okay?
Okay.
I know she spent a lot of time with you while you were in the hospital and did a lot of teaching, and she's going to continue to do teaching just like we will over the next several months, okay?
Oh, good. I'm glad.
Yes. All right. Well, it was a pleasure taking care of you.
Thank you, Doctor.
And I wish you well, and I'll see you in about 3 months.